Hi, I'm Kristen Sato, one of the primary care physicians here at Student Health, and today we'll be talking about IUD counseling. Intrauterine devices are contraceptives that stay inside of the uterus, that's the name, intrauterine, and have strings that come down through the cervix and out into the vagina. They don't come out of the vagina, not like a tampon string, but the strings come down and into the vagina and typically wrap their way around the cervix. So IUDs are one of the most effective forms of contraception. They are over 99% effective in preventing pregnancy. They are also in the family of the LARCs, LARC, which is long-acting removable contraceptives. There are two main types of IUDs, hormonal and non-hormonal. The first type, the non-hormonal, is also called the copper IUD or Paragard IUD. It can stay in the uterus for up to 10 years and acts basically as a foreign body to prevent implantation of conception into the uterus. Because there are no hormones in the Paragard, it should not disrupt the regularity of your period. So if you have a regular period, it will continue to be regular, and if you have an irregular period, it will continue to be irregular. It may cause heavier bleeding or cramping, and for this reason, if you already at baseline have heavy periods or a history of heavy periods or cramping, then this may not be the correct IUD for you. This heavier cramping and bleeding may or may not improve after the first few months. The hormonal IUDs are called Skyla and Mirena, and people always ask about the relative amounts of hormones, and it's a little bit of an apples and oranges analogy, but to give you a general idea, if this is the depot shot up here and the Paragard IUD with, remember, 0 hormone is down here, then birth control pills are sort of around here, the Nexplanon or the arm implant is right around here, and then the Mirena is here and Skyla is here. So you can see that there's not very much hormone at all in Skyla or Mirena, and we say that most likely that most of the hormone just stays down in your pelvis to act on your female organs, and very little probably circulates throughout the body. So these are really ideal in women who have heavy periods because it will lighten your period by decreasing the endometrial lining, or the part of the uterus that gets shed each month during your period. It also does not have any estrogen in the IUD, and so it's great for women who have a reason why they can't have estrogen as a part of their birth control. So for example, women who have a history of migraines with aura. Mirena is a 5-year IUD, and it works kind of the same as the Paragard by being a foreign body within the uterus, but also by thickening the cervical mucus and suppressing ovulation. And it is the same size as the Paragard IUD. The Skyla IUD is, remember, just a little bit less hormone than the Mirena, and it also acts the same way as the Mirena, but it is a little bit smaller than Mirena and Paragard, and so by smaller, it's 1 millimeter off of the wingspan and 1 millimeter off of the bottom, which in the grand scheme of things, when we're putting something into your uterus, is not a very big deal at all. The main differences between Skyla and Mirena is that the makers of Mirena made Skyla for women who have never had a baby before because it's a little bit smaller, and they also made it so that it has a little bit less hormone than Mirena, and so you'll be more likely to get a period on the Skyla than you will with Mirena. About 20 to 40% of women who have the Mirena for 12 months don't have a period at all. So those two hormonal IUDs, unlike the copper IUD, remember that you stay very regular with that one. The hormonal IUDs, you will have an irregular period. So whether that is from no period whatsoever to spotting every single day for 3 months at a time, we can't tell. And usually people are somewhere sort of in between. So you may have several months without a period and then have a couple weeks of spotting and then another several months without a period, or any combination of irregularity is totally normal. The likely side effects of the IUD insertion are cramping and bleeding. Your cramping will be the worst during the insertion of the IUD, and it will be better by even the time that you leave the office. And the cramping can last for a couple of hours to several days, but it shouldn't be as bad as during the actual insertion. It's actually pretty uncomfortable for about a minute or two, and we will talk about medications before and things like that to help out with that cramping. There are some rare but serious side effects of the IUD placement, including infection. So this is pretty rare, but is always a possibility. We do test for gonorrhea and chlamydia at the time of insertion if you haven't already had testing within the past few months or if you've had a new partner. We also use sterile technique during the procedure, and so we try and keep things just as clean as possible. There is a 2% expulsion rate, so that means that about 2% of people who get the IUD, their uterus can try and spit the IUD out. And so that's usually not asymptomatic. Typically people complain about kind of prolonged cramping, or they can feel the bottom of their IUD when they do a string check. And so then in that case, it's not effective as a form of birth control and you need to see your doctor right away. There is a risk of embedment of the IUD into the uterine wall, and so that means that it gets stuck kind of in the musculature, and not stuck, like we can get it out, but it can be uncomfortable during the removal of the IUD, and that's typically when we find out that it was embedded. There's a risk of pregnancy anytime that you are sexually active with a male, and the likelihood of that is less than 1%, but always a possibility. So because of the irregularity of your bleeding with Mirena or Skyla, you may not realize that you've missed a period, but you have to think about other cues that you may be pregnant. So like nausea or breast tenderness or combination with moodiness, I don't know. So if you have any of those things, you can always take a pregnancy test, and if it's positive, you need to be seen right away. One of the other concerns if you do get pregnant is you could have an ectopic pregnancy, which means that you could be pregnant outside of the uterus, and that typically is in the fallopian tubes. And those are not consistent with a normal pregnancy. We would not be able to allow that to continue for your safety. And so that is the biggest reason why if you do get pregnant with an IUD, you need to be seen right away to rule out ectopic pregnancy. And then one of the most serious but rare side effects is we could poke a hole in your uterus, and that's called perforation. Very, very rare, but could happen, and we have to tell you about all of the possible things that could happen during the insertions. So how do you prepare for your IUD? You need to be using consistent contraception for the 2 weeks prior to your insertion, and so that means abstinence or consistent condom use every single time without a breakage, or hormonal birth control, things like that. We don't want you to be in the process of getting pregnant at the time when you get your IUD inserted, so this is very, very important. And we will be doing a pregnancy test on you when you show up for your appointment. You may be prescribed a medication called misoprostol, and this medication helps to relax your uterus and your cervix. We ask that you place it about 8 to 12 hours prior to the insertion appointment, and you place it inside of the vagina. And it's these 2 white chalky pills that may cause some cramping or spotting, and that's totally normal. You can take ibuprofen if that happens. We recommend that you take ibuprofen or Advil, 600 to 800 milligrams, so that's 3 to 4 pills, just prior to coming in for your procedure. That really will help out with the cramping during the procedure. If you forget, we have ibuprofen here, or if you can't take ibuprofen because you have an allergy or some other reason, you can take Tylenol as well. We do perform a pregnancy test when you arrive, so make sure that you can give us a urine sample when you get here. And you may bring someone to the procedure with you if you so desire. They can be in the room or they can wait in the lobby, and that's totally fine. They won't be able to see anything below the waist, so if you're worried about that, don't be. If you are prescribed Ativan or a similar type of anxiety medication, then you will need to bring someone with you. You should be able to bike home or walk home on your own, unless you've taken Ativan, in which case we do request that you bring someone with you. During the actual insertion appointment, your provider will go over the consent form with you and answer any additional questions that you may have. You'll put your feet up in the stirrups and lay back on the exam table, and then we'll feel how your uterus is situated in your pelvis, and then place the speculum and clean your cervix off really well, and then the cramping starts right around that time. The actual insertion probably takes less than a minute or so, and it's mostly prep time and sort of getting ready for the procedure that takes the longest. But remember, I said that cramping may last for about 1 to 2 minutes, and then your cramping will get better by the time you leave the room. After the insertion, your provider will go over how to check your strings, and you should do that sometime in the following few weeks. We recommend nothing in the vagina for the next 3 days following your procedure because you are at an increased risk of infection during that time. You can take ibuprofen or Advil or Tylenol to help with the cramping, and you probably will need to do that for the next several hours to days, like I said. You'll probably have spotting after the insertion, and remember I said nothing in the vagina for a few days, and so you'll have to use a pad or a panty liner. You'll come back in for a string check appointment about 4 to 6 weeks after the insertion, and that appointment is very easy, obviously, in comparison to the insertion, but we just chat about how things have been going, how your bleeding and cramping have been, and ask you if you've been able to check your strings, if you've had intercourse since then, what your partner has to say about the strings, and we can trim the strings at that time if we need to. We recommend that you use a form of backup birth control for the week following your IUD insertion, so condoms, or you may continue on the pill, or if you're still at the end of your depot cycle, then you can continue with that. And then after that, you should be protected against getting pregnant. Some frequently asked questions. We do not need you to be on your period during the time of insertion. If you are, that is totally fine. If you're not, that's totally fine. We can, sometimes when you're on your period, it does make the placement a little bit easier, but sometimes scheduling doesn't always allow for that. You do not need to have had a baby before to get an IUD. You are not at an increased risk of sexually transmitted infections or pelvic inflammatory disease if you have an IUD. Just like hormonal birth controls, the IUD does not protect you against sexually transmitted infections, so we do recommend that you continue to use condoms with any of your partners. IUDs will not affect your fertility. When the IUD is removed, your fertility will return back to what it is at that age appropriate. And you can still use your menstrual cup even if you have an IUD. If you have any additional questions or comments or concerns or specific questions about any medical problems that you have and are concerned about how your IUD may affect any of these things, then please do feel free to contact your primary care provider. They should be able to answer these questions for you, and if they're too complicated, they may refer you on to myself or one of the other women's health providers.